Employee Health webinar. I am Wolf Kirsten. I am with International Health Consulting, and I'm actually calling in from Las Vegas today, where National Association of Worksite Health Promotion has its annual global symposium. And I'm actually taking over as president today, so it's a pretty exciting day for me. I will be moderator for today's call, and I'd like to welcome you to the second consortium webinar we have of this year. And for those of you joining us for the first time, the Global Employer Health Consortium is a thought leadership to assist organizations that are looking to improve the health and to enhance performance of their employees worldwide for competitive advantage. So today we have two presentations on a really important topic, engagement. We have Barron and Colling, and I'll introduce them in a second. I just wanted to say that the term engagement to clarify, because sometimes the term engagement is used at the workplace in terms of how engaged and motivated you are in your job, and how, in terms of kind of going for a mile. And this has been a major challenge for employers. But we really want to hone in on program engagement, and that we will do that from a global perspective. We all know how important engagement is for success of promotion wellness programs. As you know, some programs struggle to maybe 15% participate, others are high flying with 80 or 90. So we'll talk more about that. So what really makes the difference? So to shed some light on this today. Also, I just wanted to mention that we'd like to test a new feature for the Global Consortium. That is, we're going to incorporate some electronic polling questions to the webinar, so to increase the interactive element of the of our event today. So get going, as we have two good presentations coming up. So I'd like to ask our first speaker, Barron from Medtronic, to start the presentation. She is the Senior Global Wellness Manager for Medtronic. So, Jean.
Thanks, Wolf. This is Jen. I am not seeing my presentation up, and I'm not able to click my screen.
And do you have the WebEx console in front of you there?
And it just still has the screen showing the dial-in information.
Okay. Are there any arrows at the top of your screen?
Yes, there is. I tried that. Oh, there we go. Okay, sorry for the delay there. I'm just going to begin talking a little bit about Medtronic, real briefly, so you know who we are, which I feel is important. We are the world's leading medical technology company, and we manufacture medical devices that really help people with chronic conditions. Things like mainly implantable, like pacemakers, defibrillators, neurostimulators, stents. We also have solutions for diabetes, ENT, and spine. We have 8,000 employees worldwide, and about 26,000 of those are in the U.S. and Puerto Rico. Kind of an interesting fact that we like to share is that every 4 seconds, patient health is improved by one of our products. So every 4 seconds, somebody life is improved, their health is improved due to one of our products. Of the types of conditions that we treat, arrhythmias, diabetes, sinus, ENT, spinal, degenerative disc, that type of thing. So we're in 6 different businesses. We started out as a cardiac pacing company, now have moved into 6 different businesses. Something that has remained consistent at Medtronic is our mission. It was written over 60 years ago by our founder, Earl Bakken, and literally not one word has been changed. And it contains 6 statements, and the last one really talks about our focus on improving the health of our patients, alleviating pain, restoring health, and extending life. And because we're in the business of really improving health, it only makes sense that we have that same focus for our employees and our employee wellness. So our global rewards umbrella, we have 2 buckets of branding, and it's the total rewards. We really focus on resources that help employees both in their work life and in their home life be fully present and healthy. So we provide obviously the compensation financial rewards that help them, as well as what we branded total health. So the wellness, healthcare, EAP, work life type resources, which I will focus the rest of the presentation on. In 2006, we we branded our program, developed it more comprehensively, and had a more integrated approach with our total health program. And the real focus is on prevention, early detection, communication to really help increase employees and their dependents' awareness of their health issues, and also the resources that exist for them to help improve their health or maintain their good health, so keeping employees and their family members healthy as well. Also focus on healthcare consumerism. We know by having these guiding principles and this focus that we will help to improve health, improve productivity, and improve our bottom line. So wellness is not new to Medtronic. As I said, it's been a part of our business for longer than I have worked here, which is over 20 years. But kind of a timeline, in the 80s, the focus was really on putting in on-site fitness centers. We have them in the U.S., Puerto Rico, Switzerland, and several other countries. We've always, or for decades, have offered a health risk questionnaire, on-site wellness screenings we've done for nearly 15 years. And as we progressed through the mid-2000s, around 2006, we really so we need to pull our programs and resources together into a comprehensive, integrated approach. We brought in some new vendors, introduced health coaching and some health incentives, put more things in line. So we have the wellness website. And now that we're moving into 2011, 12, and beyond, the focus is really global. So what we've done for the bulk of the employees in the U.S., Puerto Rico, it only makes sense that we now focus on bringing those types of resources and wellness programs to our employees worldwide. And some of the components that we have under our total health goal is our free food vaccinations, a total health website that contains a health risk questionnaire, other lifestyle assessments, lifestyle health coaching, eating options. We're actually establishing a global healthy eating guidelines that we'll be rolling out wide. Fitness centers at many facilities, smoke-free environments. We will be rolling out global wellness challenges this year. EP programs are existent in many countries, but one of the focus for 2012 also is to have that be consistent and offered in all locations. There's club discounts or benefit programs that allow employees money to use at health clubs, like health fairs, and then just access to walking paths and things. So take a look at our timeline after we've pulled through the total health branding. In the U.S., we launched the website, the real focus on complete health risk questionnaire on an annual basis, health coaching, and then couple that with our on-site wellness screenings. And initially, we just did some fun primes to get people excited about going to the website, and we achieved about a 50% completion rate first year with our health risk questionnaire. Then we put some incentives in place for ongoing health behaviors to incent people to continue to do things to improve their health and keep them healthy. And then a premium differential was put in place in 2008, and since that time we typically reach that 90% completion on an annual basis of the health risk question in the U.S. In 2010, we rolled out the website, HRQ, and on-site. We have on-site health coach in Puerto Rico, as well as telephonic health coaching. And there, our participation is equally as good. We had put an incentive in place in 2011, and the last 2 years, we've reached over 90% actually completion of the online health risk questionnaire in Puerto Rico. In 2011, we partnered with vielife, and we brought some of these same initial resources to employees internationally. So it would be, they have the total health website, risk assessment, which is a part of that, other assessments, targeted health assessments, lifestyle improvement programs, as well as telephonic health coaching is made available this first phase of our rollout internationally. So we rolled out, we launched in 11 countries in 2011, and we have about 8 planned or more now, I think, after a meeting today, for 2012. And I'll get into more of what that looks like as we go through the slides. I think it's important to just take a step back and look at our success that we've had as far as outcomes and results in the U.S., which really gave us the momentum and approval and support to roll these types of resources out worldwide, because we are seeing significant improvements in our employee health year after year, and we continue to get a high level of engagement. So we have seen, since we rolled, and I'm using the 2006 when we rolled out our online health coaching, along with incentives, we've shifted our low-risk population. We started out at 65%, and now our low risk is at 85%. High risk went from 5% down to 2%, or 3%, excuse me. And we see the people that are working with a health coach eliminating health risk. 66% eliminated at least one health risk in 2011. We have 5% of our employees are smokers, so 95% are non-smokers. Track a cohort of participants in our screening, so that's the blood draw, year after year. So for a 3-year time period between 2009 and 11, those same people that were at risk in 2009, 58% of those are no longer at risk. 4% of the people that were at risk in 2009 for high glucose are no longer at risk. The same for triglycerides at 50%. Significant health improvements that we've seen maintain over a period of time. Cohort that was engaged with health coaching for this 3-year period of time saw reductions in 10 out of their 12 risk categories, which is higher than those who were not in health coaching. And we've done list challenges in the U.S. in the past and have great participation as well as results in those, and intend to roll those out on a global basis going forward as well. So it made sense to expand to all employees, and so on our first launch and rollout in 2011, some of the things that we put in place or felt that were important in our launch was really to build the program so that globally people, when we talk about total health, if you're in Ireland or here or China, it has a similar meaning, and you have that same branding look on the Global Wellness homepage, as well as you get into each country's website, the branding looks similar, the same. And then vielife helped us choose a theme, which we chose You Even Better, and I have some samples of what it looks like as our theme for rolling out the Total Health program, which I think helped, and it made it fun and more interesting for people as they became engaged. One of the important things is that we had right away identified a local champion that we worked with. It typically was an HR person or somebody responsible for health and safety or under the rewards umbrella. And during our initial discussions, we really spent time learning about what their employee makeup was. Is it salespeople, manufacturing? What are the challenges in communicating, and what are some of the issues that would help us be aware of as we look at communicating and launching wellness types of resources. And it was an important step to learn, as well as, what do they have already in place and what things have they been doing that we can work with and incorporate into the communications as we roll this out. So it looks like it's integrated and an extension of potentially something that they already have in place. Each of the countries we established a customized schedule for each country, as well as customized communication materials during that launch. And they had quite a few of different pre-materials to choose from: flyers. Some chose to use all of the materials that were prepared. Some chose to pare it down. So it was very flexible in that, and I think that was helpful too, so that they could choose what best for their situation. I think one thing that worked well for us was to stage our launch rollout, so we didn't try to launch 11 countries all at one time. We started out with 3 the first kind of half of the year. The plan was a little more staggered, so a few countries every 2 to 3 months, but we quickly learned that how to be very flexible with our launch schedule. Conflicting priorities would come up. We might, our champion we worked with may have taken on different responsibilities, so our schedule was very flexible, and we ended up making some shifts, and I'll talk about that a little bit more too. One positive thing about that is that we did end up launching several countries, about 8 countries at one time in number, and that allowed us to have a little bit of, we said, well, let's make this a little bit of a competition, and so I developed a leaderboard that tracked for each country their percent registered on the website as well as their percent completion. We set goals for registration and completion, and each week posted the leaderboard. And it was kind of fun to see that our friends in the UK were very slow to get started. And in one conversation that we had with our contact there, she said, I don't like being at the bottom of the leaderboard. She goes, we need to get this going. And, now they're at, 52% of people who registered have registered. So that was a big incentive. She didn't like to see how they were pairing up with other countries. So that was a fun thing, and we were able to provide some incentives to an incentive drawing for those employees during that launch. Complete their health risk questionnaire by a certain time. We had established champion calls, so ongoing communications besides the electronic communication, of course. We did actually, have phone-to-phone conversations, which is very helpful. And right now, since we have kind of finished our first year of launching countries, we have some baseline results. So we're meeting with each country, contact and review results, and going through amended next steps based on their health risks of their population and what resources we could put in place for them for more on-site local activities. And we know that it's a first phase, behavior change is a long process, and we're just beginning that. Communications, like I said, ours was You Even Better, and this is a flyer or a teaser flyer for French, or in French, and it's a name tag that says hello, hello, my name is You Even Better, and then we had the opportunity for people to have magnets made up that look very similar, and then it would have the URL and the country key code on that magnet that they could have available for employees during their launch as a visual reminder. This launch phase consists of teasers, emails, and flash animation to make it more interesting. It was important to have materials in local languages, so we were able to provide all the materials in the local language, as well as English or UK English if that's what they chose. This is a communication of a registration flyer, and after our launch phase, we started rolling out fortnightly emails, which are bi-weekly emails. I have a sample of what that looks like as well. And those are just quick health tips on a particular topic. It might be on sleep or exercise or nutrition, and it's just a quick, like an e-card type of information, as well as a link back to the site. So it keeps people, reminds them of the additional resources that are available, or if they haven't registered, to go on and see what it's all about. And this is a registration flyer example in Chinese, and I cannot tell one word means on that. And then one last example here is the on the left, the lifestyle tips for diabetes as an example of our biweekly emails that are sent out to all employees. And of course are in the local language, and a health coaching flyer, what that looks like as far as information on our health coaching program. So I mentioned we do have some baseline results. Through our communications and leaderboard and some incentives, we achieved about actually I checked yesterday, we're up to a 47% or 48% registration, and we're up to 34% HRQ completion. And the ranges most countries fell within that percentage, but we had some superstars out there in Portugal and Brazil who were in 98% completion registration and 72% completion in HRQ. And primarily those are smaller sites, so I think that definitely helped. As well, we do see a direct link to our engagement as well as from the dedication and motivation from the on-site chain as well. Our population health, the top risks are nutrition, physical activity, sleep, and stress. And that's very similar to what we see in the U.S., although body weight tends to be another one in the U.S., which we don't see in our international population, which is interesting. So these are the results we're showing on each country. This is a roll-up, but we're going through each country's results with each of the country champions. And I had mentioned that we also, along with the roll-up of the website, anybody who is in a moderate or high risk has the opportunity to work with a health coach. So they just would put in a phone number that they would like to be contacted at, and a health coach reaches out to them and invites them into health coaching. They also call and request a health coach as well. But it's a new concept in many countries. We don't have high numbers necessarily, but the people who are working with health coaches are having some very positive things to say, that the health coach is helping them be more accountable, or losing weight, increasing their activity, and that it's a very positive experience, and the coach is really giving that kick to get started, and they're seeing some great results in activity and weight loss if those are the goals. So I mentioned some of these, but some of the challenges I think that we face when I'm sitting in Minneapolis, Minnesota, and working with my peers around the globe, is that we're not there. So it's hard to know, are the emails being sent out? Are the posters being hung? Are people talking about it? So just not being present is a challenge. Having a dedicated champion, that in some of our situations, somebody may have gone out on maternity leave shortly after we started working with them, or took on different job responsibilities. So we've had some turnover, which of course delays launch and delays communications. So that is a challenge. And then keeping them engaged and motivated. Some countries it's very easy, and that local champion is doing additional on-site wellness programs and things, and others it's not as much. Like I said, the competing priorities I think is the biggest thing for our HR individuals who are also now responsible for wellness. They may be wearing several hats, many more than our HR folks here in the U.S. So we have to realize that and understand that it's going to take more time. That's one thing that we've learned is plan, double, triple the time that you might think it would take to get a form completed, to agree on a launch date. And we've taken months for people to come up with what their launch date will be. So that's just something that I've learned, and you just need to be flexible and understand that that's the way it works. Of course, the multiple time zones, it makes it more time commitment for everyone, because we can't just hold one champion call at a certain time because it might not work. It doesn't work in all the time zones, so we have to have several of those types of calls and meetings at all hours of the day. some things that helped us be successful in our first launch is that we had the support for our CEO. This is an initiative that definitely has been on the books and said, he's verbally said that we're launching wellness worldwide and globally. I presented about 2 years ago to our Global HR Executive Committee when they were here on the idea before we had chosen our partners, and really got their buy-in and got them excited so that when I started reaching out to the local contacts, they already were aware and knew that this would be something that looking forward to rolling out the wellness initiatives. In fact, I got a couple of our HR people internationally involved in actually the vendor selection process, and I think that was helpful. The approach I talked about, it was the right approach for us. Obviously, choosing a vendor who has the capabilities to provide the communications and websites in all languages that you need is critical. Work closely with HR people and understanding that there has to be flexibility in your timelines is huge, and it helps to be successful, because if you have a specific time that you wanted to launch and it's not going to work in that they don't feel it's a good time, then it's a good time and you just need to adjust that. I think competition was really helpful that I talked about with the leaderboard. And many countries actually provided their own incentives. So if they had an on-site fitness center, they may have done a drawing for fitness center memberships. In China, they did a couple hundred drawings for the first 100 people registered, and then they did another one for the second 100 people registered on site, some type of a prize. And they were able to fund an incentive corporately, which I think was helpful too. And is something that we will encourage and use going forward is incentives on a local basis. So I talked about our average registration rate, 47% and the ranges there, and health assessment completion. And we're pretty, we're happy with this. It's certainly our goal is to get registration rate up to 75% and health assessment completion rate up to 50%. And all of our country contacts that we've talked to, really feel that is attainable that they want to reach, and so we're working with them right now in discussions on how we will get there. And going forward, we will have an annual push between November and the end of January. Will be our real time frame to push people to complete their assessment on an annual basis, and some incentives with that. And health coaching has been very positive. I have one more slide on the next steps, and I'll just talk about that since I see that it's not there. But just next steps going forward, like I said, we'll be continuing to launch in additional countries, probably 8 to 10 that we know of right now for 2012, as well as we will be rolling out in September our first globalness challenge. So that would be a team-based program where people teams and compete and track their physical activity and or nutrition for weight loss, and we're really looking forward to that. We think it'll be a lot of fun and create a lot of engagement and energy around wellness, and we'll do a wellness challenge after the first of the year. And all I have.
Great. Thanks, Jean. Appreciate the excellent case study. Really interesting stuff. So why don't we just given the time we have, why don't we start our polling questions, and Barry, if you could post the first one, or do you have any instructions for that?
Yes, I've just opened the poll. You should be able to
there you go.
the polling session through your console.
So the question here, as you can hopefully see, is: do you have a defined engagement strategy, a separate part of your health promotion and wellness strategy? Yes. Sort of. No, we need one, but it's not well defined. No, it's not included in our overall no, it's included in our overall strategy. D, we don't currently have a health promotion strategy. So I'll give you like 50 seconds or 20 seconds to answer that question. So please go ahead and give your answer now.
Hi, Wolf. Just to say, I've opened each polling question for 2 minutes.
Oh, we need 2 minutes, but all right.
Regress.
Do we have results, Barry?
We do have results. We have an overall consensus that yes and solve.
Okay. Is there a breakdown of the first two in terms of particular numbers?
Yep, we have 23% saying yes, 23% saying sort of, 8% saying no, and 6% saying we don't currently have a health promotion.
Okay. All right. Interesting. So obviously there's agreement that it's an important issue, but there's a lot of companies who are participants today who don't have. There we go. Who have a separate engagement strategy. So that's pretty interesting. So actually a good segue to our second speaker, which is Jess Colling, who's product director at vielife, because she's talking about specifically engagement strategies and the philosophy behind it. So do you want to go and start your presentation?
Thanks. First of all, can you hear me okay?
Yeah, I can.
Good. Okay, I will keep going. Please let me know if you can't. So thank you for the introduction, Wolf. So as you said, the focus of my session is to really talk about some of the ideas behind engagement and what the key components are to an engaging program and why engagement is so important in a successful wellness initiative. So I'm saying the differentiator for success. So as you mentioned at the very start of the call, Wolf, engagement can mean a number of different things. So we'd like to start with thinking about what is engagement. A few things kind of immediately spring to mind when somebody is referred to as being engaged. The first being potentially get married or to be making a commitment or a promise to someone, or to be engaged on the phone, as in the other person is busy. Or if we look in the dictionary, we see a number of different definitions of securing the services of somebody, or to employ them, to part or participate, or to promise to do something. Or my personal favourite is to involve a person or their attention intensely, to engross or to occupy. So if we continue to think about this involvement, or if we say ring analogy again, it's about creating a relationship, so a going, trusting relationship, and combining that overall engagement with health really create a lot of positives. So being good work-life balance, creating a great place to work. And finally, if you have a workplace where people want to come to, then you are going to get more from them while they're there. You're going to get greater participation in work, greater interaction with their colleagues, and an overall better output. The great thing about engagement is it will give you better insight into what your employees actually need. If they trust you, they will tell you which of their needs are being met and which of their needs are not being met. We wanted to address the question really, why engagement? But the first part of this is really greater participation. You'll get a much larger number of participants in any initiative if people are engaged. If they're bought into it, they're likely to take part. And let's face it, even the best designed initiatives will fail if nobody uses them. And nobody will use them if they don't know they're there and they're not bought into them. Mentioned that Medtronic have been doing wellness since 2006, and I think that's a great point to illustrate sort of the point on this slide, which is really that building a culture of wellness, and particularly a global culture of wellness, is a long-term venture. This isn't something that can happen overnight. It does take time, and it takes effort, and you've got to use a number of different strategies to be able to put together an overall engaging package of activities and initiatives. You've given us a lot of great examples of where it's possible to achieve well-being change, and there's lots of research to show the impact that these have on business performance. And there really are lots of opportunities to make positive changes to well-being. We've seen this over and over again of how lifestyle habits very strongly with increased sickness absence and reduced productivity, and both in terms of, of combined behaviours, as well as at a specific level, such as having poor nutrition. So, in terms of developing a health and well-being initiative, fundamentally, the things that we're trying to achieve are to be able to deliver long-lasting behaviour change to improve people's health, and obviously be able to deliver the business benefits that are associated with better health. And to have those things, you need to have people engaged in the services that you are offering. So, what makes a happy, engaged employee? Well, there are key components to this. I'm not going into these in a huge amount of detail, because I will pick up a number of ones in relation to sort of health and well-being a little bit further through the presentation. But obviously, health is important, both psychological and physical health. If people are in good health, they are more likely to be happy and engaged at work. Have a nice environment. There's things like getting the basics right, making sure it's not too hot, not too cold, people have enough space. All of these things are actually important. Relationships with others. People who like their colleagues and work well with them are much happier at work and also get more done. Some interesting research linking sleep, for example, with poor sleep profile with people's ability to trust and interact well with others. And actually, so there are some well-being areas that compound all of these things. And if people, don't trust each other, then they're not going to have good relationships. Stability, obviously being secure in your job, but also feeling financially secure, is important. That your job also has a purpose, satisfied with the work you're doing, that it has an element of challenge to it, but also that there's a good balance between what you do at work and what you do out of work, and that those, there is no hard and fast rule about what is a good work-life balance, but it's what is appropriate for you, and what is the right level for each individual. So, look at that happy aged employee and about the overall work culture. I want to take a bit of a deeper dive into what contributes to an engaging work culture, and then particularly look at how these apply in the context of a health and wellbeing program. So, we have 5 central tenets that we look at when thinking about engagement, and Jen has already touched on of these in her presentation. So some of this, apologies, will be a little bit of repetition, but some of it be augmenting the kinds of things that we can do to actually create a very engaging work environment. So leadership, support, environment, communication, community. I'm going to go through each of these in turn. Leadership. What do I actually mean? Well, senior leadership buy-in is absolutely crucial. It's important for financing the initiative. It's important so that people actually feel that they can spend time doing it, that it's authorised and approved. We have also seen that it's not just the senior management that needs to buy in, it's also the middle management need to actually engage in this, because often they are the people that actually control people's individual time, and if this is something you're wanting people to do in their work time, they have to be given the freedom and the time to be able to take part in that. Support. To make changes, people need to be supported. They need to feel supported, and so there are a number of different ways that we can support people with those lifestyle changes. This will be providing tools, so tools, resources, it's all presented together in a central area so that people know where to access this information and what benefit it is going to give to them. Think about the practical things that provide support for people, AP services, health coaching, in-person services. What are the elements that you could make as part of your program that would make people feel supported? Community. Building a community is obviously a core part of building a culture. And Jen's given a lot of great information about building a network of champions and building a local network of champions in particular. Having these kind of group activities or challenges and competition can be incredibly effective at getting people involved on a regular basis in making changes. Making changes to your health is difficult, so actually getting people involved on a regular basis is really important for being able to achieve that long-term behaviour change. Environment. One of the things that we encourage people to do is to do an environmental audit and make sure you've actually thought about what is the place that you're going to be putting this initiative in. What are the limitations and what are the great opportunities that you have with your particular site or sites that you're going to be rolling this out. Are there things that you can do in that environment that would encourage people to take part in an initiative? Can you have an on-site presence? Can you have ongoing campaigns? What can you use that's special about your environment to make things different? Making sure that you have materials in areas of high footfall, or if there's information that you might want people to write down and take away with them, particularly like a telephone number for an EAP service or a confidential helpline, you perhaps want to put that in more of a private place, so it's the bathroom, where somebody can actually write that down in private. Lastly, communication. Really, really important to get the communication right. Keeping it simple, keeping it clear, but most of all, making sure that it is tailored and appropriate for the place that you are going to use it. As Jen said, clearly having the available in the local language, is a really important factor. If you can roll it out in a different territory, make sure you actually are doing it in the local language, but make sure that it's also localized for that country or site, as well as actually being translated. Also think about what are the right types of communication materials to use. Are posters and flyers the right thing to use, or is it a voicemail message from the CEO? What is the right thing for your organisation to make it work? So, thinking about those 5 things together, what is also really important is that it needs a very holistic approach. Engagement isn't a one-size-fits-all solution. It's important to have lots of things that work together. And as you kind of look at those 5 key areas, undoubtedly, your organisation will be strong in some of those, maybe not in all of them. And all of them need to work together to get very engaging solution. Basically, you need awareness to be able to get participation. You need buy-in so that people can spend time on it. You need, to be able to make this behaviour change, as I've said, you need sustained participation, and that comes from having the support from the community and from the environment. And finally, it's got to be something that people want to take part in, so the look and the gut feel and the goals have got to resonate with individuals. Now, I understand we want to do another polling question, so I'm going to pause right there. We'll do the next polling question. I said we get the poll going, and then I will continue, and then we can look at the results.
Yeah, thanks, Jez. Just read it, and then you can keep going. What kind of engagement rate do you want to attain? So obviously you all want the 100%, but what's realistic for you in the foreseeable future? 20% or more, 30% or more, 50% or higher, or 70% or higher. So please all of you respond, because last time we had quite a few people who didn't respond. Just why don't you continue in the meantime?
Great, well, okay, so while everybody's filling in their polling questions, I will talk a little bit about some of the kind of materials that we can use, but also the impact of engagement. Generally shown some of the examples of some of these tools, but there are things that we can use to keep people engaged. So games, posters, using different themes that are appropriate for your particular organisation, emails, flyers and materials that actually
useful information. And also having branding around particular initiatives. If you're going to champions, give them branding, give them something that they can actually get behind and support. Jen has already shared lots of information about the program that Medtronic have run and the results that I've seen, that they've seen, but I would like to put a slightly different spin on it. First of all, we'll congratulate and say thank you to Jen for taking engagement so seriously. I think you'll all agree from listening to Jen how passionate she is about this program and the fact that it's been running for 6 years now. But also had the courage to back new ideas and work with us in creating engagement campaigns that really worked for her employees around the world. And by taking by using a creative approach, games using a continual drip feed of information, going schedule of activities, but really crucially also by working with local leads across the globe, so that they in their own materials, territory. Medtronic have really supported the people that want to make changes. Here's some skeptics thinking, well, having someone like Jen in place, Medtronic would have always had that kind of engagement, and maybe with the culture that's been created, they would have done. Look at how their results compare to a company who are sort of similar in profile, who didn't invest specifically in engagement. The results are quite different, and Medtronic have achieved a sort of a five-fold difference in participation through focusing on engagement than a similar sort of size and shaped organisation who didn't focus on this. So I'm going to wrap up by just giving you what I would consider to be sort of the golden rules of engagement. These are in no particular order. Using a variety of communication methods. Use all the tools that are available to you. Think creatively about what materials and ways that you can communicate to people. As I said, is it voicemails, or is it messages in the payslip? Is it posters, or is it packages that are sent to people's own homes? Think about all the tools that are available to you. Relevance to your workforce. It's got to be relevant to all the different locations. This actually links to a point at the bottom here, which is about incentivization, and really this is about incentivizing appropriately. This again has got to be relevant to the country and the place that you're putting this in place. In the US, for example, incentives are very common and a very normal part of any wellness program, and the incentive dollar amounts that are put against this can be extremely high. However, if you look at that and roll that out across Europe or Asia, actually you have a very different environment where people have incentives, and it's not part of the culture necessarily to be paid to take a health risk assessment. So again, it's looking at what is appropriate and what can be funded for that kind of incentives. Make it look nice. If it doesn't look nice, people won't pick it up. So it doesn't how good the information is, they won't ever read it. Keep it simple, keep it straightforward. Use all the community and groups that you have available to you. Create new ones. Use the value of competition, again illustrated beautifully that it can be powerful in getting people to take part. Have clear and vocal management support. You need your leaders backing this and taking part in this. But most of all, be flexible. To adapt your strategy depending on the feedback that you get and the results that you see. You may not get it right the first time, and that's okay. But actually being flexible and being prepared to do different things and try different ways of approaching this is really key to the success of any engagement strategy. So I will leave it there, as I know we've got a few minutes left for questions, and say thank you very much.
Yeah, thanks, Jez. Thanks a lot. That's great. First of all, the polling results, I hope you can see. First of all, you guys need to be more active, because still quite a few didn't answer. But let's see here. In terms of the results, I think there's overwhelming agreement that 50% or more is what you're trying to achieve with participation with engagement. So that's good. Like 20, 30%, not good enough. And other companies are around those numbers, so we have quite a bit of work to do to get to those above 50% engagement. So that was the result of the polling. Was quite. I would open up for questions now because we're getting close. I think we only have one, Barry. Is that right?
Right, Wolf, yes. We have a direct question to Jen, I believe, from Karen Marlowe. She says, in the data you presented on the percent of the population at high risk for various risks like nutrition, etc., how do you define productivity or effectiveness?
We define productivity or effectiveness or measure it. I'm gonna guess she's talking about measure it. And there are some questions in our U.S. Health assessment that get at productivity, and so we look at that on it's not presented here, but we look at that for health risk assessment. Questions that are around how many days have missed work in the last year, I think it is, and those types of questions.
Jen can also add to that in terms of, one of the things that we do with the vielife data is also measure productivity and effectiveness, and then that again is using questions within the overall health risk assessment that have been validated. So we are measuring what we think we're measuring, but it is self-reported in productivity and effectiveness, and then correlating that with how people in different risk groups respond to those questions. Very happy to share more data, Karen, if you'd like to talk further about that.
In fact, on our results slide, it does have job satisfaction and productivity effectiveness listed out, and those are our top low percentage of people at risk. We only have 7%, so we're really, really well based on that in our international countries.
Okay, good as usual. Always challenged to measure productivity. Others, Barry, do you have any other questions?
Yeah, there's a note from Brian Ritt here. Says that Jess skipped over the incentive appropriately bullet. Could you give a little bit more detail on that?
Absolutely. Sorry, I put that into making it relevant to the workforce. But in terms of incentivization, there are lots of ways of looking at this, and really this does vary a lot by country. As I said, in the US, it's very normal for there to be perhaps a $100 voucher attached to completing a health risk assessment, or some kind of reduction in health insurance premium for doing that kind of assessment. Because of the way that sort of healthcare systems are structured, there isn't that much money available, to be honest, in European markets. And if to suggest to a client that they pay $100 for everybody to take a health risk assessment in Europe, would probably laugh out of the room. So, but incentivization can be very powerful at getting people to do particular activities. So Jen mentioned prize draws, and these have been used very effectively to drive participation in a particular activity. So, for example, if you want people to complete a health risk assessment, using a prize draw, or something that appeals culturally. So, perhaps in sort of the Asian countries, luck is very important culturally. Actually, having a prize draw can make it very much into culture, as well as being something that can help people participate in a program. Whether incentives are useful for long-term behaviour change is a different conversation altogether, and one I'd be very happy to have offline if you'd like to have that conversation. Rich.
Good. Very good. Now, if we have one, or
we do. Yeah, we do have one final one. In fact, actually, Wolf, if you wouldn't mind, I'd like to just open the poll up for the third question, just for a minute, just to get some interactivity going, and also ask the final question from Trish Manning. While I open the polling question here, it said, have your opinions changed about the role of engagement? Yes, no, or no, I'm not really convinced are the answers here. So the question is from Trish, then spoke about health coaches. Are these employees or provided through the vendor?
Health coaches are provided through the vendor. So internationally, vielife has relationships with coaching providers in each country, so that those health coaches are available in that local language. So they are, they're there. So if it's in Netherlands, that coach will be able to speak Dutch. And then in the U.S., they are also provided by our U.S. vendor, technically, and then our health coach. We do have a on-site one in Puerto Rico, but they're all non-Medtronic employees. I think that's important.
Okay. How about results? Do we have the results yet for the polling? So we're kind of at the end here.
The results are just collecting now. Just give me a few seconds.
No problem. Just I wanted to remind you of the website of the Global Consortium, which is at discussglobalwellness.com. And if you have not seen it, I would advise you to take a look. So some interactions, discussion forum. There's some more information actually on presenteeism on there, which you can do. So that's useful. Also access to past webinars and a link to a YouTube channel. So just take a look at discussglobalwellness.com. Okay. As here, the answer is no. I already, the main, let's put it this way, that the main kind of here is that most of the people, participants, were already convinced that it is an important element in engagement. So that's good. So we have a very educated crowd. But I still hope you learned quite a bit today. And I certainly would like to thank our two speakers for presenting. Thank you very much. So that's pretty much at the end of our webinar. Provide us with your feedback as always, and also in terms of future topics and regions. And our next webinar will take place in June. So thank you very much for everybody for joining, and I wish you health productive weeks. So goodbye. Talk to you next time. Thank you.